Okay, good afternoon. Welcome to our webinar this afternoon. I'm just going to pause for a few seconds just to give people the chance to sign in. If you are in the room, if you could perhaps pop something in the chat panel to the right of your screen for me, please, just so that I know you can hear me. That would be really useful. So we'll just give people a little bit of time to come in and to let me know that you can hear me okay. Brilliant. That's fantastic. Thank you. Okay, great stuff. So to get started then, welcome to MidKent College. My name's Steve. I'm going to be your host for this afternoon. And this afternoon, we're going to be talking about healthcare and childcare. And I'm joined by my colleague Lisa, who's going to tell you a little bit more about those subjects a little bit later on. Normally, we would bring you into our campuses for a normal open event. And the things that people tell us they like about those events are the opportunity to have a look around the campus, but also the chance to speak to our teaching staff, to ask the questions that you really want to know about what you're going to be studying in September. Now, obviously, at the moment, I can't bring you into the campus to do that, although we have got some brilliant 360-degree photos on our website to give you a feel for our classrooms and workshop facilities. But although I can't bring you in at the moment, what I can do is give you that direct access to our teaching staff. So in a moment, Lisa's going to take you through some details about our programs, and obviously you'll have the opportunity to ask questions about those too. So that chat panel to the right, where you've told me that you can hear me, keep using that throughout the session this afternoon. If you've got questions that you'd like us to answer, then please pop them in there and we'll look after them there for you. You've got Sue looking after you in that chat panel this afternoon as well. Sue's a member of our course inquiries team and knows a huge amount about all of our programs. So Sue will be trying to answer some of those questions for you, but we'll also flag up some ones that perhaps I can ask Lisa as we move through. If we don't get a chance to answer your question in the session this afternoon, don't worry. We'll make sure that we come back to you with an answer. That might be that we email you through the email address that you've registered with for this session. So just to give me an idea of who we've got in the room this afternoon, at the top right of your screen, you'll see there's a tab called Polls. If you wouldn't mind clicking on that for me, please, and if you could answer that question. So I'm just interested to know whether you've already applied for a health or childcare programme, or you're here this afternoon just because you're looking to find out some more information. That's brilliant. So I can see those answers going in. So even without all of them in at the moment, I can see, Lisa, that we've got a mix of people on the call today. So we've got some people who've already applied for programs and some that are here to find out more. So we'll make sure that we keep that in mind as we go through this afternoon. So I want to kick us off just by sharing a short video from Simon Cooke, who's our principal, which is just a quick welcome to this afternoon. So let me play that for you now.
Hello there, I'm Simon and I'm the principal of MidKent College. It's great to be able to talk to you, and I so wish I would be able to talk to you in person, but virtually, hopefully your opportunity to get to know a little bit more about the college will help you with your decisions that you need to make. So over the next 30 minutes in this virtual open event, you're going to have an opportunity to meet one of the tutors from your chosen subject area. Really make the most of that time to find out what it means for you. Ask some questions. No question is a silly question. Please ask whatever question you've got. Take some notes, but make sure that you've got the info that you really need to make that decision about what you want to do in September. And if you're really not sure what you want to do, then you're not the only person. There are lots of people every year that we see. It won't be any different the current year under these current circumstances who really don't know what they want to do. There might be even some of you who are thinking you really don't know what to do because you see what's going on in the world and you're not quite sure what job prospects there may be. By the time you finish your programme, the world will be a different place again, and there will be many more opportunities then that may not exist now. So talk to our staff about it. And also don't be frightened if you don't know what you want to do. Have a look at some of our other sessions. Come into other sessions and see. What's really important, and one thing I say to everybody who comes into the college, you must feel comfortable with the people that you're going to be sharing your next few months and years with. And I want you to feel comfortable that you're going to be able to flourish and thrive as a person, not just study a qualification, but flourish and thrive as a person with those people you talk to. So if you don't get any of the answers that you think you need in the virtual session, we've got a brilliant team on our course inquiries, and we've got a brilliant team in our careers office who will help you navigate the language, what options there are, and for you, what's the right thing to do, which is a question we often get asked every year. I hope you enjoy your session, and I really hope that I get to see you very soon at the college, and we look forward to welcoming you with us in September, if not in person, virtually, that's for sure. Good luck.
Okay, so thank you to Simon for recording that for us. I'm just picking up from the chat. We had one person that was struggling to hear that. I just want to make sure that you can still hear us okay. So if you could just give me a thumbs up or a wave in the chat just to let me know.
Hi, I don't know if anyone can hear me. Can you just let me know, please? Okay, great. So I'm just going to go through these slides that we have here, and then I'll answer some questions for you. So good afternoon, everyone. It's really great that you're here. I hope you can hear me. So firstly, we run a range of courses. We've got level 1, level 2 and level 3. We do BTEC courses and we also do MVQ courses. So the BTEC course is quite an academic course that will include exams, and the MVQ courses are courses that are of the same level, but they are more practical based. So you can all courses have work experience, but with the MVQ they're more practical based, so they're more to do with competency and applying those to practice. So I can tell you more about those as we go along. Okay, so we have a level 1, level 2 and level 3. Okay, you might be able to see on the slides that a range of some of the units that we deliver on those programs. So BTEC level 2 there are 7 units in that program. 2 of them, actually we've just changed this program. There are, I think now going to be 8 units, but 2 of those will be exams. But there's an example there of some of the content that we would deliver. So patterns of childhood development and supporting children's healthy eating. On level 3, that's a 2-year program. And so there are 8 units in 1 year and 7 units in the other year. And there's 750 hours of work placement that is split across the 2 years. I'm happy to tell you more about that as well. We are in a very privileged position, because in our setup, assuming that we will be able to use it fully, we have a hospital room on site, which includes 2 beds in 1 room, bedside cabinets, etc. And we can teach you lots of things about hygiene, changing bed sheets, hoisting, lifting, all sort of safely. We also have a kitchen room for health and social care, which also has a bed, and we have mannequins, so you can learn and develop your skills before you take the work practice. Also, for our health and social care students, we work in partnership with the Medway Hospital. I believe we're one of the, if not the only college that has the privilege of doing this. For level 3 students to begin with, both years, get the opportunity to go and participate in lessons with qualified staff at the Medway Hospital. So they cover a range of subjects such as maternity, dementia, scrubbing up for surgery, resuscitation, all sorts of things. So we've got lots of unique opportunities here at MidKent College for health and social care students. In childcare, sorry, I'm just going to go back to this slide. Just for childcare, we have a sensory room and a nursery area. Some of the, or all of the childcare courses also contain practical elements. So you've got some unique rooms where you can go into the sensory room and plan activities. And then we have a nursery area as well, where you can practice skills and then take them out into the work placement. As well as that, we're looking at connections at the moment with Forest School. So that'll be up and coming. So again, we offer some very unique opportunities with childcare and health and social care courses here at MidKent College. Just going on to here, we also offer some very nice residential trips. Obviously, depending on how things pan out this year, fingers crossed, we will still get the opportunity to go. And we've been to places like Disneyland Paris, we've been to Body Worlds, and we also had a trip planned to Budapest, but that is something that we're going to be looking at doing again in the future, to look at how different people manage different situations and different needs for different people. There are also, as part of the work placement, there's opportunities to participate in residential trips as part of your placement, where you can go and volunteer for a week at a time and really gather and gain some really, really good work experience. As well as that, at the college, several times a year, we've been involved in competitions locally. We compete against other local colleges, and we have placed very well in the last couple of years, and it's all quite exciting, and the students really get some good fun out of it. We spend a day making resources or working to a brief and compete with other colleges. So that's quite exciting as well. So we've got many opportunities. If you decide to do a level 1 course and you complete your level 1 course, you can then progress on to level 2 if you've fulfilled all the criteria. The same with level 1 to level 2, level 2 to level 3. And then if you complete your level 3, you can go on to university if you want to become something like a teacher or a nurse. And if you just want to get out into the work placement, our qualifications give you a nice, robust, well-recognised qualification that we have a very good take-up from local employers. So some of the job roles could include worker, social worker, midwife, nursery worker, Senko, primary school teacher, dental nurse, optician, all sorts of things. And I've given you a mix there of health and social care and childcare roles. I think my slides, Steve, would you like me to elaborate on any of that?
One can hear you okay, so that's fantastic. I'm the least important person here. Yeah, we've got a couple of questions in the chat already, but obviously as we're still talking, if you've got other questions you'd like me to put to Lisa, please let me know as well. But Lisa, the first one I'd like to put to you is one from the chat, which is someone who's already applied, they've had their interview, and they were told that their course would involve a work placement. And their question is, how will work placements work now with obviously restrictions around COVID, etc.?
Okay, so the answer to that question is, at the moment, we're not 100% certain. It will depend on whether work placements open up to us again, because pre-COVID, as it was coming through, they did stop students going to the hospitals, they did stop students going into the nurseries and placements. However, we're quite optimistic that when things do sort of come to a new normal, that our students will be allowed to access again. We haven't been told at the moment that that will not happen. In the unlikely event that we're not allowed to access work placements, as I've said, we have got some very, very good practical resources and rooms in our college. where we can set up scenarios, and we do have a team of assessors as well. So there is a plan B if should we need it, but actually we're very, very hopeful and positive that work placements will go back to, albeit a new normal, but our students will be allowed access to their normal work placements again eventually.
That's brilliant. Thank you. I mean, more broadly around coronavirus, and I'll mention this here because it's come up in pretty much every webinar we've done this week. People asking, well, what's September going to look like? The answer is really we've got about 8,000 students that we work with, and as much as we would love to have all of our students come back onto site with our staff and into our classrooms and workshop spaces, as long as we need to maintain social distancing, then actually that's a real challenge for us, like it is for any other education provider or business. So we will always make decisions that put the safety and well-being of our students and staff first. Now that means that by September, if we're still under social distancing regulations, then what you can expect to see is a bit of what we call blended learning. So you'll have the time that you spend at college with your tutor, but in quite small groups, and we'll be managing the number of people that come on site overall, but also the number of people that are in any individual classroom, so that you can make sure that you can distance effectively. But you'll combine that time that you spend in class with additional learning that you'll do at home remotely, supported by your tutor. Now, there's a fantastic amount of resources online for students to use to add to their studies anyway, and we've always encouraged students to do that. But I guess what we're now doing is looking at actually adjusting timetables to make sure that we give you time alongside your taught sessions with your tutor to actually take part in some of that digital learning as well. So I don't have all of the answers today, but what I can assure you about is that we'll take decisions that put people safe over and above everything else. We want you here. Don't get me wrong, we'd love to have you back, but more than anything else, we want to make sure everyone stays safe. I've got some other questions that have come in. Lisa, bear with me a second. We had one about uniform. So could you tell us a little bit more about uniform requirements for these programs, please?
Yeah, no problem. So yes, we do have a uniform, and we do have a supplier for our uniform, but I haven't given details yet because we do need to have that confirmed. But we have a uniform supplier in Chatham, and our uniform is a black polo shirt with a almost turquoise MidKent College emblem. I don't know what the word I'm looking for is. Yeah, logo. Thank you, Steve. So it's a plain black with a turquoisey sort of logo. It's plain black trousers or jeans, no rips or tears. They have to be all in one piece. No jeggings or leggings, and no blue jeans. Trainers, black or white, or black shoes, whatever is comfortable. You can wear boots as long as they're sensible. And then a black fleece zip through, or a cardigan, no hoods, please.
Okay, that's fantastic. Thank you. We had a question about interviews, which Sue's actually dealt with in the chat, but just so that we're clear for everybody, at the moment, because we can't bring people onto site, we're running telephone interviews with applicants as well. So if you do submit your application, the next step will be for you to have a telephone interview with either Lisa or a member of her team to just talk through your application, find out what you want to study, where you want to go after you finish your program as well, and get your place sorted at the right level for September. So yeah, I think Sue's answered there. Normally within 15 working days, those telephone interviews take place. I've got a couple of other questions for you, Lisa, if that's okay, just to give people some time to think and put things in the chat if they want to. So could you tell me, we pride ourselves as a college on the fact that our tutors have all got industry experience, which means that the things that you teach, you've done that job, you've been there and done it. So could you tell us a little bit more about your industry experience and how you use that to benefit our students, please?
Yeah, sure. So when I first started in my career, I was by trade, I was a dental nurse. So that's health and social care based. So I spent many years being a dental nurse. Then I had a family, so I went into the care sector, and I was a domiciliary carer. So I was caring for a range of people within their own homes in the community. I've been a community childminder, looking after children and families of various different backgrounds and needs. I've worked in nurseries. I've been a nursery manager, primary school teacher. I've got a long length and breadth in childcare and health and social care. I've been a family support worker, and currently I'm a curriculum manager and lecturer in health and social care and childcare. I managed, like you may do, to do my level 3 at MidKent College some time ago. I then went on to do a degree in childcare, and then I went on to do a master's in early years education. So I've got a level 2 and a level 3 in health and social care as well. So all of my knowledge and experience I apply to my lessons, and it's very, very, very useful. But we pride ourselves on the fact that we do have quite a wide range of skills and expertise within our area. So we have other lecturers that also have degrees, MAs, teaching diplomas. So all of us come with a good proportion of industry experience. And I think it really makes your experience as a student valuable, because we can sort of link to real life situations, and if stuff that you might be experiencing in placement we've probably seen before or we know before, and we can really help you to apply your practical skills to your written work. So yeah, we've got lots of that going on in our department.
Brilliant, thank you. I've got another question, which is from somebody who wants to do level 3 health and social care, but is nervous that they're not going to pass their maths. So could you tell us a little bit about that, and will that be an issue for them?
Okay, if I'm honest, it could be an issue. It does depend on what the college will allow criteria-wise. Normally, you have to have 5/4s or above, including maths and English, to do a level 3. But don't forget, we do offer a level 2 as well. So there's something for everyone. If you don't quite get all 5, we can still offer you a course. And it may mean that you do another year, but actually for some people, that's really, really beneficial. It really bolsters their knowledge. We do a case-by-case scenario, though. So if you were to have 5/4s or above across the board, and it was literally just your maths and your other grades were 4s, then we can go case by case. If we think that you would be able to manage the content, etc., then we could appeal that for you. That's what's normally happened. I don't envisage that would change. But either way, I would say do not worry. It's a very strange year for results and stuff. Even if you can't quite get enough grades for the level 3, we do still do a level 2 course, which is equally as valuable, and you can still progress. So, you know, it may mean just a bit more time with us, which would be great for us.
Yeah, there are a couple of follow-up questions that have come up in regard to that as well. So, you know, I can probably field the first one for you, which is someone who's applied, they've had their interview, do they need to contact us once they have their results? I think what we would do is contact you in due course to invite you in for an enrolment session, and you would bring evidence of your results along with you to enrolment. And I think, you know, going back to what Lisa's just said, we do understand that this is a bit of a strange year, particularly if you've sat GCSEs or you were due to sit GCSEs this summer. So, you know, we will take that into consideration. And I think, you know, our priority and our responsibility is to make sure that we've got students on the right courses and at the right level. So I think, you know, don't worry about your grades. We will help you with that. But once you've got those grades, even if you don't meet the criteria that were there and in your offer letter, don't sort of give up hope. Talk to us, and we'll support you through that.
Absolutely.
Okay, the chat's very busy, Lisa, so just bear with me a second, just while I make sure we cover everything. Just going back to the uniform, I've got someone asking for clarification about when they need to get their uniform and where they buy it from.
Okay, so uniform, our usual supplier is in Chatham, but obviously I do need to wait for confirmation to make sure that you know, everything's okay there, and that's, you know, that will come with time. So normally Once we've enrolled you and you're on one of our courses, we will give you the details of where you go to buy your polo shirts and fleeces if you want fleeces. So that information should come out around about the time that you enroll or just shortly after. So we will keep you totally informed there as to where to get them from. Okay, but yeah.
Okay, brilliant. We've got a query about how we support students with additional learning needs, so additional learning support. Is there anything you wanted to say about that, Lisa?
Okay, so ALS is not a problem to us. When you apply, we ask that you put as much detail as you can onto your application form. It will not absolutely have no impact on receiving a place or not, so please don't worry. We have no issue. We can manage most, if not all, scenarios. We have a dedicated team, but what we do like is to know about what your needs are so we can have things in place by the time you get to college. So just to give an example of some of the ALS needs that we sort of manage, we have students that may have ADHD, we have students that have Erlands and need coloured paper, we have students that need scribes, readers, extra time, reading pens, all sorts of things. We have students that may have a form of disability that we can cater for, allergies, physical disabilities. So please do not worry. My advice to you would be, there is a place on the application where you can tick to say that you require ALS. I will ask you, or my colleagues will ask you at the point of interview, whether you have any ALS support, whether you have any individual needs, what you need from us to enable you to learn effectively and how we can support you. And then we work with the team very, very closely so you get the right support in the right place. Okay, I can honestly say, hand on heart, we have not come across anything that we've not been able to manage today. Okay,
that's brilliant. Thanks, Lisa. And just to add on to what Lisa said, we did toy with the idea of running one of these webinars with our additional learning support team, but actually we thought, because the nature of those conversations are probably that you need to share some quite personal information, and the chat box on the side of this window would not have been the right place to share that. So what we'd ask is, if you do want to speak to someone in the ALS team, if you go to the help and advice page on our website, you'll actually find contact details directly into our additional learning support team if you want to speak to them about your situation, and just to get some reassurance about how we can support you. A little bit more on eligibility criteria, please, Lisa. What sort of grades do you need for a level 1 qualification in health and social care, please?
I think that has been answered in the chat, but I think for a level 1, you need 4 F.
Okay, no, Sue, I can see Sue has answered it.
Yeah,
So
I don't know what grade it, like number is. It's a 2, I think.
Yeah, so 4 GCSEs at grade F or equivalent or above, including English and Maths at grade 2 or above. Sorry, it was slightly laggy on my screen, so apologies.
It needs to be Maths or English. It doesn't have to be both. And level 2 is 4 3s or above, including Maths or English.
Okay, that's brilliant. Thank you. And as we said before, the eligibility criteria will be detailed on our website for each program as well. If you're not sure which level you should be applying for, like I said before, it's part of our responsibility to make sure you're on the right level. So don't let that be a barrier to putting an application in. We can help you through that. And then I've got one final question in the chat for you.
Can I just, before you move on to that question, can I just let people know that I know you've just sort of said this, but if you're worried about meeting the criteria for a level 1 course, we do actually do a foundation course in health and social care and childcare as well. So please don't worry, we pretty much have, stuff available for everybody.
Okay, it's brilliant. Thank you, Lisa. I think we've covered pretty much everything in the chat that I can see. So I'll rely on colleagues just to give me a little bit of a nudge if I've missed anything. But because our time is up, I just want to skip past a couple of bits. It's far more important that you had the time to talk to Lisa than to hear from me. So I'm not worried that you don't get to hear everything I'd planned to say. really just to sum up, in terms of next steps, if you haven't yet made an application, then the best way to do that is to go to our website. That's www.midkent.ac.uk, to search for your program and apply using your predicted grades. Now, if you're not sure about how the application process works, what I want to do is direct you to the top right of your screen, where you'll see there's a tab called Handouts. And in there, you will find some common FAQs. So they're the kind of things that I would have talked you through if we'd had a little bit more time this afternoon. You'll find FAQs that take you through the application process. So if you want just a step-by-step guide to submitting your application, please download that too. And also some student finance information too. So if you're interested in some of the financial support that's available to support you in your time with us as a student, then that's there too. So please feel free to download any of those documents before you leave today, just so that you've got them to hand. I've just had one last question in, Lisa. So if you don't mind, I'll just hold you for a couple more minutes. I've applied for the Level 3 Child's Play Learning and Development course. Please, could you explain more of what happens in that course?
Okay, so the Level 3 CPLD is made up of 15 units. There's 8 in the first year. There's 7 in the first year and 8 in the second year. In the first year, there's 2 exams. In the second year, there's one exam, but obviously we will prepare you for all of those. There's 750 work placement hours, but don't panic. I know it sounds like a lot, but we split that into over the 2 years. So you do 375 per year, and you get the opportunity to work in 3 different settings. So 0 to 2, 2 to 5, 5 to 8. So you've got your exams, you've got your practical element, and the other element to the Level 3 course is that you do assignments. So if you're not doing an exam, units, you'll be doing assignment units, which is all input with some practical elements, quite fun really. And then we'll give you the input in your talk sessions, and then you attempt your assignment. And your assignment is marked pass, merit or distinction. When you submit your assignment, you get an opportunity to resubmit if you meet all the criteria.
That's brilliant. Thank you.
Yeah,
and I'll take this one as the last question, because it links to what you've just said. You talked about work placements during your last answer. So is a work placement something that students should look to sort out before they join us in September?
Okay, so work placements, yes. Ordinarily, we would advise you to have a look at a work placement that you might like to go to, because some people like to go to somewhere close to home. That's absolutely fine. If you've got an idea of where you want to go, that's absolutely fine. Just let us know when you come to college, and we'll see if we can sort that out with you and for you. There is a BTEC specific specification that all placements have to be graded good or above by Ofsted. So you can't go into a placement that requires improvement or is below the grade of good. So they all have to be graded good or above, not satisfactory or requires improvement. We do have a work placement coordinator, so we'll do a DBS check with you, and our workplace coordinator will help anybody that doesn't know where they want to go. We've got a big list of placements that take our students.
Okay, that's brilliant. I will have to leave it there because we've run over time. I need to let Lisa carry on, and we've got some other webinars we need to run this afternoon. I'm conscious that there are a couple of other questions there that we've not addressed, so we'll come back to you outside of this webinar to answer those. Hayley has posted into the chat the fact that if you do need some more help, we've got a team that are able to support you with that. So our course inquiries team, who've been looking after you in the chat this afternoon, if you do want to speak to them, you can reach them on 01634 40 20 20. If you'd rather talk to them on live chat through our website, if you go to the website midkent.ac.uk, or you can send an email to course.inquiries@midkent.ac.uk. I'm really grateful grateful for you all for taking the time to come and listen to the webinar this afternoon. And Lisa, thank you for your time too in answering those questions.
Thank you.
I hope it's been really useful for you, and I hope it helps you make decisions about what you're going to do in September. If you do need any more help, then please use those details that are on screen at the moment. But for this afternoon, thank you all again for coming, and we look forward to seeing you in September. Thank you.
Thanks,
Bye-bye.
everyone. Bye.